Thank you. Good morning, everyone, and thank you for joining us. So with the COVID update, these are numbers as of Wednesday of last week. The case rate was 36.1 per 100,000. In comparison, in January, we got to about 253 per 100,000. So although we are continuing to see an increase in cases, it is way below what we were seeing in January. With the hospitalizations, the last report we got is we have 150 people with COVID in the hospital, and 20 are in the intensive care unit. And in comparison, in January, we got up to about 600 hospitalized and 125 in the intensive care unit. There are some early indications that there may be a slowdown, but it's too early to tell, so we continue to monitor. We know that this most recent surge is caused by subvariants of Omicron. So initially it was the BA2, then the BA2.12, and now there's the BA4 and BA5. And so there are a number of variants that are circulating and contributing to the increase in cases. We continue to follow state guidance and strongly recommend masking. Businesses can choose to make masking mandatory, especially if they have a lot of interaction with the general public, or if they're seeing an increase in cases among employees, or if they have an outbreak. Masks are still required in healthcare and congregate settings. Also, a strong reminder is that vaccines are our best protection. So we continue to encourage everybody to be up to date with their vaccinations. With that, I'll turn it back to Samantha for questions. Sam, you're on mute.
I have one question in the chat box. Eaton Wallace would like to know how many hospitalizations and ICUs were there in January?
So in January, we got up to 600 hospitalized and 125 in the intensive care unit.
Does anyone else have a COVID question?
Jamie, do you want to
go ahead and ask yours?
Yes, I was looking at the updated dashboard and I am unable to look at the variant data on the laboratory testing page. I was wondering if that was still being provided.
I think we took off the variant information, but it's all Omicron or subvariant of Omicron currently.
Michael, go ahead.
Yeah, I know in recent weeks we'd seen some outbreaks in school settings as schools are now kind of, when most districts are either ending their school year soon or already ending. Is there any changing recommendations as we move into summer and people start to travel and do different things compared to the last month or so?
I'm sorry, could you repeat what your question is?
Just do we expect to see any change in where we're seeing the cases come from in that past month or so? We've seen some cases linked to schools and school events, possibly. Do you have any recommendations about people that may have summer travel plans that might be concerned as cases are rising in parts of the U.S.?
Well, we're seeing cases from different kinds of settings. You've mentioned schools, work settings. So our encouragement to everybody, especially for people that have conditions that put them at risk, is that when you go out into the public that you wear a mask. And we also encourage everybody to be up to date on their vaccinations. We are not sure what's going to happen as time goes on. Of course, our hope is that we are getting to the peak of this recent surge and that we will start seeing a decline. But as you've mentioned, with increase in travel, there is that increased risk of exposure. So people do need to be careful. People do need to continue wearing masks.
Daniel, go ahead.
Thanks. Yeah, could you talk a little more about the variants, the various subvariants, and what is kind of emerging as the latest one, or are they all kind of about the same?
Jamie, do you want to take that one?
Like which, let me look up the most recent one. I'll be right back.
While she's looking it up, if you recall, the first one that subvariant that we got was the BA2, and then that we started seeing the BA 2.12 that started showing up in our surveillance data. And I think Jamie's ready.
So the BA2 is still the predominant circulating strain currently. It makes up the vast majority of the ones that we have sequenced. And just as a reminder, we don't sequence every single case. We just sequence a subset. But the BA2 is the vast majority. And then we are seeing in the past week some BA212 and some BA2121. So those are the predominant.
Is there any different, like for people that hear these numbers, you know, what's the difference between them? Is there anything that is more concerning about one or versus the other?
For the general public, it's I guess the difference is that the more recent variants tend to be more contagious, and also a reminder that people can get reinfected. So the best way to protect yourself is to be up to date with vaccinations and also to wear a mask when going out into the general public.
Okay, thanks. If I could ask one more.
Go for it.
With the latest surge, is it affecting any particular demographics or zip codes differently than had been until recently? Is there certain areas of the county that are getting it worse?
We're still seeing the same pattern in terms of areas that are seeing more cases.
Yeah, it's very similar to the past. We've seen in the last 30 days a slight uptick in the age 50 to 34. We've seen a slight uptick among whites and Asians, but again, they're not huge differences.
Mike, go ahead.
Yeah, one more question. Do we have any, does the county have any data on reinfections? And if so, are those becoming more frequent or more common with the new variants?
We don't have specific data on reinfections, but we are hearing that people are getting reinfected.
Do we have any additional questions regarding COVID? Okay, seeing none, we are now going to move on to monkeypox. So Dr. K will give an update and then we'll open it again to questions. Go ahead, Dr. Kasiriye.
Sure. So this morning we did report a 4th case of monkeypox, and this was also identified through contact tracing. Monkeypox is a viral disease that can be spread from person to person through respiratory droplets or by direct contact with lesions, with bodily fluids, and also with contaminated clothing or linen. The early symptoms of monkeypox may include flu-like symptoms like headache, fever, backache, but a person may not have any of those symptoms and may see lesions appearing. These lesions may appear in any part of the body. They usually start off as a hard nodule, which then becomes a vesicule and then may open up into an open sore. We have been communicating with our healthcare providers since this is a new disease to remind them to have this as a differential if they have someone reporting to them with a lesion with lesions, and also especially if they also report recent travel to Europe. With that, I will turn it back to Samantha.
Are there any questions for Dr. Kassirier regarding monkeypox? Daniel, go ahead.
Yeah, so this fourth case identified through contact tracing, is this from, are all of these cases, are they stemming from the initial case? And can you tell any more about this contact tracing and, the difference between all the various cases that we have right now? And when you say confirmed, do you mean this was a reported, is it presumptive or was it confirmed by the CDC?
Thank you. For clarification, it is presumptive. We did our initial testing at our public health lab to show that it was part of the orthopox, but because this is a part of the contact tracing, that is why we identified it as a presumptive case of monkeypox, because there is that epilink with other cases. We are waiting for confirmation from the CDC in order to count it as a confirmed case. I do have to let you all know that I can't provide a lot of detail about the different individuals because we have a small number that we're dealing with and we have to maintain confidentiality because we're still trying to elicit information. And so it's dependent on us being able to maintain their confidentiality in order to get the information that we need.
Michael, go ahead.
Yeah, could you speak a little bit more specifically to the timing of this latest presumptive positive, like when it was, tested for orthopox by the county, and also are any of the 4 total cases? Can you speak to the severity of them at all? Are they all considered mild? Are they any hospitalized, things like that?
All of them have had mild disease and are isolating at home. This 4th individual was identified at the end of last week, and the testing was done late Thursday, and we got the results on Friday.
Eaton, go ahead.
Doctor, thanks for taking the time, and same with you, Ms. Motz. Really appreciate it. Question, Doctor. In terms of your message to the public on monkeypox, what is that?
Monkeypox is not known, has not been occurring in the United States, so it's a new disease to us. It's a viral disease. Right now, the cases that we are investigating are epilinked or they are connected. And so at this time, the risk to the general public is low, but people still do need to be aware of the existence. And so if anybody does happen to develop a disease that has lesions that may appear to look like monkeypox, that they need to contact the healthcare provider.
Miriam, go ahead.
Hi, good morning. My question is, how long is the contact tracing process? Do you expect more presumptive cases in the near future?
So what happens with each case that is identified, the contact tracing starts all over again for that individual. So since this individual was identified at the end of last week, so now we're just starting the contact tracing for that individual. And we will continue to do it as long as we identify new cases. Usually for a disease like this, we would wait at least 1 incubation period with no additional cases in order to determine that the outbreak has ended. So it will be at least 3 weeks of no additional cases before we can close this.
Daniel, do you have another question?
Yes, thank you. So yeah, kind of to piggyback on that, do you expect more cases? And were you surprised by this 4th case or did you expect it?
Well, we were hoping we would not get any more, but of course, that's the reason why we do the contact tracing, is because we know how this disease is spread. So what we do is find out from the individuals who their close contacts were, and then go ahead and contact those individuals as well and ask them questions about if they are experiencing any symptoms at all. We also do offer them a vaccine. There is a new vaccine that's available right now. And for individuals that do test positive, we can also offer them treatment.
Do we have any additional questions for Dr. Kassirier?
Or you said the vaccine goes to people that are close contacts of those who had tested positive?
That's correct, yes.
Eaton, are you raising your hand?
Yes, I am. I appreciate it. Doctor, just a question about that vaccine. So unlike the COVID vaccine, this isn't something you could just get at a Rite Aid somewhere or anything like that. It's specifically, something, or can you?
That's a very good question. So as you've mentioned with COVID, we do offer the vaccine to anybody that is eligible. And so we have a lot of people, millions of people within Sacramento that have so far taken the COVID vaccine. And that's because of the way that the disease is spread. COVID is spread by a respiratory system. And so people can get it without, just by being in the same room with someone else. With monkeypox, the form of spread, it doesn't spread as easily as COVID. For example, we did mention that it can be spread by respiratory droplets, but you would have to be in the same space with someone for at least 3 hours in order to be considered exposed. And so it doesn't spread as easily. And right now, all the individuals that we have identified as positive, we've been able to epilink. So we know that we can limit the vaccination to people that have been identified as contacts. The vaccine, we have to order it from the CDC, and it comes through the state. And then we request what we need from the state. It is not available at any pharmacy.
Okay, one last call for additional questions. Daniel wants to know how many people have received the vaccine.
I don't think Rachel is on the call. She is our immunization program manager, so we'll have to get back to you on that.
I can include that information when I send out the recording of the of this. Any other questions? Okay, seeing none, I am going to conclude the media availability. I will send the recording of this out later this morning, and I'll include an answer to the question from Daniel. Thank you all.
Thank you.